Have you ever noticed tiny specks or strands drifting across your field of vision? These little shapes can be quite distracting, especially when you're trying to focus on something important. These are called eye floaters. They are small, shadowy shapes that can appear in your line of sight, often moving as your eyes move. They can look like little threads, squiggly lines, or even tiny dots. Sometimes they might even appear as cobwebs or small cloud-like shapes. Don't worry, you're not imagining things. These floaters are real and are a part of the natural aging process of the eye. Eye floaters are a common occurrence, and most of the time, they're nothing to be concerned about. They are usually harmless and don't interfere significantly with vision. Eye floaters are more noticeable when you look at a bright, plain background like a clear blue sky or a white wall. This is because the contrast makes them stand out more. They seem to dart away when you try to focus on them directly, which can be a bit frustrating. This is because they move with the vitreous gel inside your eye. But rest assured, these little floaters are harmless and usually fade over time. In most cases, they become less noticeable as your brain learns to ignore them. So, what exactly causes these mysterious floaters? It all comes down to the anatomy of your eye. Inside your eye, there's a jelly-like substance called the vitreous humor. This gel helps maintain the shape of your eye. As we age, the vitreous humor can change. It starts to shrink and become slightly stringy. These stringy bits can cast tiny shadows on the back of your eye, which is where the retina is located. The retina is like the film of your eye, and it sends images to your brain. Those shadows are what we perceive as eye floaters. Now, you might be wondering about another visual phenomenon called the blue field entoptic phenomenon. This intriguing visual effect often catches people by surprise and can be quite fascinating to observe. This is where you see tiny, bright blue dots moving across your vision, especially against a bright background. These dots are most noticeable when you look at a clear blue sky or a brightly lit white surface. While it might seem similar to eye floaters, it's actually a different thing altogether. Eye floaters and the blue field phenomenon are often confused, but they have distinct causes and characteristics. Eye floaters are shadows cast by bits of matter in the vitreous humor. These bits of matter can be tiny clumps of gel or cells that float within the clear, gel-like substance inside your eye. The blue field phenomenon, on the other hand, is caused by white blood cells moving through the capillaries in front of your retina. These white blood cells are larger than red blood cells and create a unique visual effect. These white blood cells create tiny gaps in the blood flow, and when light hits these gaps, we perceive them as bright blue dots. This phenomenon is a natural part of our vision and is usually harmless, though it can be quite mesmerizing to watch. Remember, most of the time eye floaters are harmless and just a normal part of aging. These tiny specks or cobweb-like shapes that drift across your vision are usually nothing to worry about. They are often caused by the natural changes that occur in the vitreous, the gel-like substance inside your eyes as you get older. However, there are a few instances where you should consult an eye doctor. It's important to be aware of these situations so you can take prompt action if necessary. If you experience a sudden increase in the number of floaters you see, this could be a sign that something more serious is happening inside your eye. Or if you see flashes of light, which might look like little sparks or lightning streaks in your vision, it's essential to get your eyes checked. These symptoms can sometimes indicate a more serious condition that needs immediate attention. These could be signs of a more serious issue, such as a retinal tear or detachment. A retinal tear or detachment can lead to permanent vision loss if not treated promptly. It's always better to err on the side of caution when it comes to your vision. Your eyesight is precious, and taking quick action can make a significant difference. Don't hesitate to reach out to an eye care professional if you have any concerns. They are there to help you and ensure your eyes remain healthy. They can examine your eyes and provide appropriate guidance and treatment if needed. Regular checkups and timely consultations can help maintain your vision and overall eye health.